American Indians and Alaska Natives born today have a life expectancy that is 5.5 years less than the U.S. all-races population, at 73.0 years to 78.5 years, respectively.
Each year, the all-cause age-adjusted death rate for white people was lower than the national population, while that of black people was consistently higher than both the national population and the white population. Black/African American people are 2.8 times more likely to die from COVID-19 than any other community. On Sunday, December 20th, 2020, Dr. Susan Moore passed away at the age of 52 from complications due to the COVID-19 infection. In her efforts to advocate for herself while seeking care, she was able to document her experiences of medical mistreatment and negligence, which were fueled by racism within the healthcare system.
Colorectal cancer is the third most common cancer in adults in the United States. Those individuals who are non-Hispanic Black, Hispanic, non-Asian, and non-American Indian or Alaska Native patients are all less likely than non-Hispanic white patients to receive a fecal occult blood test or an endoscopy to screen for colorectal cancer.
Breast cancer is the most common cancer in women in the United States, accounting for 30% of all new cancer diagnoses in women. Black patients with breast cancer are less likely than white patients to receive radiation therapy to the breast within 1 year of diagnosis. Amongst those aged 18 and over with any mental illness, 69.4% of Black/African American, 67.1% of Hispanic/Latinx, and 73.1% of Asian/Native Hawaiians and other Pacific Islanders go without treatment.
My name is Asase Obo, and I am the National President of the Student National Medical Association for the 2020 to 2021 administrative year. We, the members of the SNMA, are dedicated to addressing the needs of underserved communities that are disproportionately of color. We acknowledge that we must first address the role that healthcare systems and the medical community have played in constructing and or perpetuating systems that produce and or uphold health disparities and inequities in this country. The medical community is a social and structural determinant of health, and acknowledging that is necessary in the pursuit of health equity. Therefore, the SNMA urges the following recommendations to address health disparities.
We must increase everyone's access to affordable and equitable care in order to decrease racial and ethnic health disparities. This can be achieved by creating a universal healthcare system and establishing more programs aimed at addressing the gaps in healthcare access seen in the poor and near poor populations.
There should be a strong emphasis on recruitment and retention of physicians of color, supported by institutional incorporation of cultural and structural competency training modules and lifelong learning of health professionals.
In order to address the lack of physicians of color, the SNMA believes in increasing funding for math and sciences at the elementary and secondary school levels, especially for programs catering to students of color. There should also be more focus on developing mentorship and shadowing programs between minority physicians and other healthcare workers and students of color.
The availability of financial assistance to underrepresented minorities throughout all levels of education should be assured through public and private sector scholarships and loans. Existing programs, such as the National Health Service Corp, should be broadened and utilized as a vehicle to increase financial aid to minority students interested in medicine and other health professions.